Hi, I'm Nicole. I'm a registered nurse here at Providence St. Joseph Hospital. We are so happy to have you here with us. I would like to take a few minutes to show you through your procedure process from the time you register till the time you go home. You will see many of our excellent caregivers here in surgical services, as well as get a tour of the facility and an idea of what to expect day of surgery. Before we get started, I want to mention something about getting ready for your procedure. You will likely have a pre-op appointment scheduled in a few days or weeks ahead of time. This appointment could be in person or maybe a telephone call. It's important that you have about an hour set aside and a list of your medications ready for the RN to discuss with you during your appointment. There will be a lot of important information given to you during this time, so please make sure not to miss it. On the day of your procedure, you will start here and enter through our main lobby. Once inside, you'll find the temperature kiosk where we will check your temperature and provide you with a hospital-issued mask. From here, you will be directed to our registration clerk who will check you in, and then you will have a seat in our lobby until one of the nurses comes to get you. Once you come back into short stay, you will meet your admitting nurse and see the other members of your team. We will then show you to your room where you will change into your gown and be prepped for your procedure. We will have a belongings bag for you to put your clothes in and provide you with anti-slip socks to help prevent falls during your stay. Please remember to leave your jewelry and valuables at home. After you have had the opportunity to change into your gown, we will ask you a series of questions while obtaining your vital signs such as blood pressure and heart rate, as well as start your IV. Depending on your specific procedure, you may have additional steps taken to prep you for your procedure. We will make sure to take this time to explain in more detail what to expect, answer any questions you may have, and address your concerns. You will have a chance to talk with your surgeon as well. Now that you are ready for your procedure, you can lay back and relax. Sometimes there may be a wait of an hour or so before your procedure starts. So don't hesitate to give us a call with your coli if you need anything at all. We have the time to make sure that all your needs are met. You will meet your anesthesiologist and OR nurse shortly before your procedure starts. Then, your short stay nurse will give a handoff report to your OR nurse and you will be transported back to the OR. Once inside, you will meet the rest of your care team and they will help you transition from the gurney to the procedure table. The room is kept cool, but we will make sure to keep you warm with blankets out of our warmer. Please don't hesitate to ask any questions or communicate any concerns or discomforts. Your anesthesiologist will then begin to administer the medications that keep you comfortable and sedated during your procedure. Depending on the type of anesthesia you are receiving, you may or may not have a breathing tube inserted once you are asleep. After your procedure is complete, your care team will help you transition back onto the gurney and transport you to the recovery room. You will be connected to a monitor where we will closely observe your vital signs while you wake up. The anesthesiologist and procedure nurse will give your recovery nurse a handoff report, and your recovery nurse will do an assessment. You will be in the recovery room until you are ready to go back to short stay, if you are going home, or up to the floor if you are spending the night in the hospital. If you are going home, you will come back to short stay. We will provide you with something to eat and drink during your recovery and do all we can to keep you comfortable. We will have an approximation of when you will be ready to go and will contact your ride to facilitate your transition back home. If the doctor has written any new prescriptions, we will make sure to call them in or provide you with a paper prescription to take with you, as well as make sure you have a follow-up appointment scheduled as ordered by your doctor. You will receive a copy of your discharge instructions as well as education specific to your procedure and the sedation you received that should help you answer any questions you may have when you go home. All patients receiving sedation are required to have a wheelchair ride out of the hospital, and we are happy to bring you out to the pickup drop-off zone in the front of the hospital to meet your ride.